through the years, Atlanta's community has helped hundreds of people to move into the community and advocated for the rights of people for that. The ADAPT was created in 1983 by people of Atlantis and has fought for the Community Choice Act. Our question to the transition team is if you will have the strength to fight the special interest lobbyist groups to give people with disabilities the rights and that they deserve.
Hi, I'm Dawn Russell. I'm a member of ADAPT and want to talk about the Community Choice Act. The Community Choice Act is national legislation that would end the institutional bias. Right now in the country, people have an entitlement and the right to live in a nursing home. People with disabilities, we want to live in our own homes. This is our 10-year anniversary of something called Olmstead versus LC and EW. The Supreme Court decided over 10 years ago that it's people's rights, their civil rights, to be able to choose where we live and receive services. The Community Choice Act is national legislation that would allow people with disabilities across the country to live and receive services in their own home. Today in the country we have a bias in our Medicaid system that says that people have the right to live in those institutions, but we don't have the right to live outside and receive those same services. This is legislation that we've been working on as far back as Newt Gingrich. It's very responsible legislation that will be fiscally responsible to where we need to go in this country and in this.
I guess I'm to speak about having the decision not to be in a nursing home and so you can use your own thought, your own mind, and so things aren't done for you. You can do it all on your own. And although help might be needed for physically, you can't do things physically, and so yeah, so help might be needed in that part. And let's see. But for the most part, just being able to have the freedom to make your own decisions.
My name is Latonia Reeves. 16 years ago, I was living in Tennessee, and I had to transfer from Tennessee to Colorado for the lack of services. And I started the Underground Railroad. And this is the Disability Underground Railroad so that people like me wouldn't have to be stuck in a nursing home. I made this vow to myself that if I can be free, everyone else should be. And I also help transition people out of nursing homes into their own homes. And I do get an award in myself for that. And with this legislation, it would help people like me become free and can do anything they want to in the community.
Our mission and what we do is to provide opportunities for individuals to live in the community as to institutions if they choose to do so. And through that, we have a vehicle through the Medicaid waiver program, through the EBD, HCBS programs in Colorado that are geared towards individuals living in their own homes as to nursing homes. Along with the legislation, we have other barriers that are impeding our people from leaving the nursing homes. One of the top of those is housing. Housing in the United States in general is extremely hard to come by, especially if you're using a wheelchair and you need an accessible apartment. What we in ADAPT look for is affordable, accessible, integrated housing that can provide the most freedom to these individuals that we are attempting to serve. And we're really hoping that this issue can be addressed as long and as with the CCA legislation. Thank you.
My name is Gil Cáceres. I became disabled in 1980 in my hometown of Austin, Texas. I had no idea of what lay in store for me. I was looking at becoming self-sufficient again. I still lived at home. One day I was coming from a market or some location, and I saw a group of people rolling down the street in wheelchairs. A guy named Bob Kafka saw me in the from the lead. He, as they were pulling by, he asked me to join the line, and I don't know what was happening. We were going towards a restaurant or some location that was discriminating on wheelchair users, and from that point, I do recall I found a calling from that aspect. I joined a group called ADAPT, and from there we rode to different locations around the country, protesting the APTA organization to make buses and public transportation accessible for people with disabilities. And once the ADA was passed in 1990, I decided to move to Denver to continue the struggle and fight for community choices and rights for people with disabilities. I've been in Denver since 1990 and continuing that struggle for passage of the Community Choices Act. And will be until the end.
Hi, my name is Michael O'Donnell. I'm a community transition assistant with Larry and Latanya. And I was in a nursing home for rehab, and it took about a year. I was there for a year. It took about 6 months for me to find a place. When I found a place, they procrastinated and kept delaying my discharge. So I got on a waiting list, and I got the keys on my birthday and moved out a week later. The way I found out about Atlantis is from my social worker. After I left the nursing home, I volunteered, and then I got hired here at Atlantis. The reason why I took this job is because I know from experience, and I can relate to the people in nursing homes. Atlantis is a very important cause, and this is why I'm here, and this is why you should support the Community Choice Act. Thank you.
Hi, my name is Kyle Nash, and I've been working as a personal care provider for Atlantis for 2 years. Personal care providers and certified nurses assistants are a vital cog in the home health care machine. We're responsible for the day-to-day services for the clients, such as getting them out of bed or completing household tasks, or anything else really that they would require of us to live independently. We also serve as a bridge between the nursing staff and administration services and the clients. And the biggest problem that we're facing right now is the wages aren't competitive with wages that nursing homes are able to pay. And it's not because of greedy executives or misspending on the part of the home health agencies. It's because we lack the general funding that nursing homes do. We don't have the same amount of revenue coming in. We don't have money coming into home health agencies the way they do. So we're not able to compensate our attendants as well as they are.
My name is Marcy. I was taken to a nursing home in 1975. I lived there until the 1990s. I then was drawn about adapt and I was told to contact adapt. Then I would be able to come out and live by myself. So I did make contact with a dad and was able to come out and find my home and live like a common person and be able go make a choice in my living. Thank you.
Hey, how you doing? My name's Katrina Rice, and I came from Montana, and I came to Denver, and who would have guessed that I would be coming to Denver to be working with ADAPT and Atlantis, which is really kind of cool. And the reason why it's so stinking cool is because you got people that are still fighting after 25 years for the same thing. And I'm emotional. And and everyone's rocked by the same thing, wanting to do the same thing that they started off with. And there's some really good benefits to the basis of what we're doing, besides the object that we're also thinking about your guys' future and everyone else's future, my future included. And that is a blessing to have that. Forgive me while I have to read because I don't have a very good memory. It says, but the big thing is I'm an attendant here at Atlantis, and wow, it's some really good things in it. But at the same time, because of wages and things that are going on, it makes it pretty difficult. And compared to nursing homes and what they get paid, and I worked 12 years in a nursing home, and I got to say in payment, there's quite the difference. And you got a lot of people today that are having to pretty much live their life on Medicare because they can't afford the natural income that those that are in nursing homes that are receiving in wages and basis. And you know, and then we also have government programs that we have to rely on too, and that's probably the best thing, saying that we need the government to help us. And it says if we pass, if we're passing the Community Choice Act, we'll definitely assure those funding for everybody, and that would be a blessing in disguise too. And it says, but evenly, we have to allow all of us, those that are competitive in the wages in home health and nursing home, we need to have it equal. Because if you're really thinking about it, technically speaking, well, no technical about it, we are all under the same category. We're here to help each other to be able to move on. And if we can get ourselves out of that little loop, man, we'd be just so far ahead of ourselves. We'd be like, wow, we don't know what's going on. It would just be cool. So, sorry about the excitement, but just overall, I just want to let you know that these guys are a great cause. And if they're still fighting for the same thing that they started with, you should get, that says it off right there.
We believed the Community Choice Act is the answer to the question that we've been asking for 30 years now. Why people with disabilities would need to be institutionalized in the first place. The Community Choice Act is federal legislation that allows people with disabilities to live in the setting of their choice and receive services in the setting of their choice using their Medicaid dollars. In Colorado, we have this. We have a lot of room on our waiver programs, and so essentially we have this. But in other states, they do not. I do not want to see my friends or my families in other states be forced into nursing homes or institutions because their family can no longer care for them. In the beginning of Obama's campaign, he did a piece where he spent the day as an attendant, just like our attendants do. Probably not a Medicaid attendant, but an attendant. And he provided services to an elderly man who was diabetic. And he did a great job, and he made the job look respectable. But the important piece of that is that that man was able to stay in his own home because of the services that were being provided to him by our next president of the United States. My question to the transition team is, are you going to back up what he said at the beginning of the campaign? Are we going to see community choice pass this year and allow all of our people to be set free? Thank you.
Good morning. My name is Dale Reed, and I'm the administrator of the Home Health Agency here at Atlantis Community. And I'm a member of ADAPT and advocate for people with disabilities. One of the problems, or one of the things that has been worrying me, is the changes that President Bush has made in the rules about reporting from the people who do surveys for nursing homes. We get people out of nursing homes because we don't believe that that's an appropriate place for most people to live. We certainly believe that anybody can live in the community with the services and supports that Colorado at this point provides for people in the community. but that the Community Choice Act would allow across the country in Medicaid programs. Bush has changed the rules for reporting on in nursing homes, saying that surveyors no longer have to report to individuals who request the information about incidents that happen in the nursing homes. Anybody who wants that information, and it has to go all the way up to CMS, the Centers for Medicare and Medicaid Services, in order for them to get an answer, so that if somebody dies as a result of an incident that happens in a nursing home, nobody can get that information unless CMS is willing to allow that information to be released. Home health agencies, on the other hand, people like me and my attendants, all of our information is public knowledge, and it certainly is the way that nursing homes should be also. Thank you.
Hi, my name is Sheila Dean, and I'm from Atlantis Adapt. I became disabled at the age of 28, and I ended up in a nursing home at the age of 29. And I had a son that was 7 years old, and I had no idea about living inside of a nursing home at that age, and I wanted to get out. No one would give me any information or anything, so one day they set my check up on the table for me to sign it over to the nursing home, and I told the nursing home I wasn't going to sign it because they didn't need it that month. I snatched the check and I put it in my pocket, and I rolled out of the nursing home. And I lived out in the community. I mean, it was hard, struggling, but I found Atlantis Adapt, and now I'm fighting for my rights and other people's rights inside of nursing home and in the community. Thank you.
We want to thank you for the opportunity to present the Community Choice Act and what we feel is important in our community, and to present this to Dashiell and to say that this is the time to pass the Community Choice Act.